What I did is just try to minimize the use of psychiatric medications, using them at very low doses, one at a time, not combinations.
You posted something recently. You said government lies about climate, they lie about disasters, lie about our food, lie about our health, and they've trained the doctors. And so the doctors a lot of times believe they're saying the right thing, but they're talking about what they're trained to believe, and it's exactly that. It's a very similar conversation we have Dr. Gabrielle Lyon to as a dear friend, and she talks about food and the lack of training thereof. As you start seeing these things, as you start understanding these things, what do you do as a doctor who is in the field? What do you do with that information? What did you do? Because you are vocal about things, but that can't be an easy decision to make to be vocal.
There was a progression of what I did actually,
Yeah.
because I was still practicing psychiatry for quite a period of time once I started learning these things. But at first, what I did is just try to minimize the use of psychiatric medications, using them at very low doses, one at a time, not combinations, take people off ones when they come in on 3 or 4 drugs, that type of thing. And that evolved to taking every patient off all their psychiatric medications once I really had enough experience and knowledge to see that not only were they not helpful, but they were harmful. And I tried other interventions, but the system that I was working within didn't really allow that. The facility I worked at did start appreciating me taking the kids off the medicines for many reasons. One is they saw their behavior actually improved, and these were troubled kids, juvenile delinquents and such. But they also were paying something like $40,000 or $50,000 a month for psychiatric drugs. Because these were kids, they didn't have insurance or they were on Medicaid and it was a non-formulary drug and all this kind of thing. And that went down to a couple of thousand a month while I was the psychiatrist there. So they really appreciated that aspect of it.
Sure.
But ultimately, I couldn't really intervene properly with things like nutrition and detoxification, only in very small ways, but I did have some minor successes.